Hi, hello, namaste, welcome back to our channel. My dear student, today's session about myocardial infarction. The myocardial infarction topic belongs to medical surgical nursing. Whereas, so what is the meaning of here myocardial infarction? You can see in our medical terminology, myo is nothing but middle layer of the heart, cardia is nothing but heart, infarction is nothing but collapse, whereas necrosis also. So what exact meaning of myocardial infarction? It is also known as heart attack. Is it? So myocardial infarction is nothing but due to the blockage of coronary artery. So due to the blockage of coronary artery, it leads to myocardial infarction. You must know what is the meaning of coronary artery. As we know that every organ belongs to the human is needs to the blood supply. As usual, for the heart also need blood supply, so through the artery, that nothing but coronary artery. In some kind of the causes, if the coronary artery is getting blocked due to some kind of reasons, in that case there is insufficient blood to the myocardium, the middle layer of the heart, that will leads to myocardial infarction. So that's about today's session, my dear students. So here it is definition is telling, it is defined as of insufficient or interruption of the blood supply to the middle layer of the heart. It leads to heart attack, as we know that. So what is the risk factors? So what are the risk factor may chance to get? So because of this risk factor may chance to get the heart attack. The first one is tobacco use and lack of exercise, high consuming of the cholesterol, and obesity due to high tolerance of the stress. So because of those levels, because of those factors may chance to get heart attack, I mean myocardial infarction. And some other non-modified risk factors also is there due to the family history, due to the congenital deformity, due to the elder age and diabetes, hypertension. So these are the modified and unmodified risk factors to get the myocardial infarction. Let's see what are exactly causes for getting myocardial infarction. The first one is coronary artery disease. So coronary is artery which is supplying blood supply for the heart, middle layer of the heart. It is consuming the blood through the coronary artery. If some case due to the cholesterol plug, that is nothing but atherosclerosis, due to the narrowing of the coronary artery, it leads to insufficient blood supply. When it is insufficient blood supply to the myocardium, in that case insufficient oxygen blood supply to the tissue of the heart. In that case, the heart functioning is going to decrease. So that is the exact cause to get the heart attack. And second one is the blood clot. Due to the clotting of the blood in the artery, nothing but coronary artery, it leads to insufficient blood. And next one is coronary artery spasm. The spasm is nothing but narrowing. If it is narrowing of the coronary artery, it leads to insufficient blood. So these three are called as the exact cause to get the myocardial infarction. Is it? And next one is what is the pathophysiology? In that case, how the disease condition may occur. As we know that the different causes, atherosclerosis, arterial spasm, and this thrombus formation. So these three causes within the coronary artery may occur. In that case, obstruction will occur. Ischemia is nothing but occlusion or obstruction. When it is occlusion is occur, in that case hypoxia will occur. What is the meaning of hypoxia? Decreasing percent of the oxygen within the layer of the heart. When there is a decreasing percentage of the oxygen level, in that case the permanent thrombus will form. When it is a permanent thrombus will form in the coronary artery, in that case necrosis will form. Necrosis is nothing but death tissue. So when the death tissue we found in the heart muscle, that will be called as myocardial infarction, that is called as heart attack. So this is exactly what the pathophysiology is showing for the myocardial infarction. And next one is what is the signs and symptoms? When the patient, in the case of scenario, when the patient is having myocardial infarction, what kind of the symptoms is going to show? So the first one is low cardiac output. When there is some problem within the heart, definitely the cardiac output may decrease. And next one is a chest pain. Whatever the problem is you are facing within the heart, the chest is getting some kind of tightness, some kind of heaviness, some kind of this kind of pain. And next one is decreasing pulse. The pulse rate will be the decrease. And bradycardia, nothing but decreasing of pulse rate is called as bradycardia. And hypertension, the blood pressure will increase. Is it? Next one is dyphosis, is nothing but excessive sweating. When there is a problem in the heart, definitely the symptom you can observe, that is nothing but increasing of sweatness for your body. And ultimately you can find ECG changes. So how the ECG can changes, I will show. And rest of the symptoms like shortness of the breath, you can't be able to breathe properly, you will feel some kind of heaviness, some kind of chest tightness also. Pulmonary edema, the fluid accumulation within the lungs also may chance to get in the case of myocardial infarction. And as I said, chest heaviness. And next one is difficulty in breathing and fatigue, you feel some kind of sickness in the case of myocardial infarction. So what is the diagnostic evaluation? So because of this diagnostic evaluation, because of these diagnostic findings, you can find whether the patient is having heart attack or some other disease condition. The first one is physical examination as usual, and second one is history collection, and third one is stress test, and next one is chest x-ray. So this is a chest x-ray for understanding visualization of the cardiac muscle and size of the heart. So by that you can understand the capacity, the normal capacity of the muscle structure of the heart. And next one is ECG, is nothing but electrocardiogram. It is a analyzing process for intervalling of the or frequency of the ratio of PQRS waves. If it is abnormal frequency, if it is abnormal intervals, in that case there is some kind of the problem you can able to find out within the heart. And next one is echocardiogram. It is one of the specialized cardiac diagnostic finding technique where you can see in-depth find outing of the abnormality of the heart. You can take the image in-depth sound abnormalities, whereas in-depth tissue abnormality through the echocardiogram. So that is about echocardiogram. Next, the specialized technique for the find outing of atherosclerosis within the coronary artery is nothing but cardiac catheterization, is nothing but called as angiogram. So angiogram is nothing but inserting of the catheter through the femoral artery into the heart, into the coronary artery. In that case you can find out where exactly position of that plug, where the exactly position of the spasm or narrowing of the coronary artery. In that case you can find where the location. So this is about the myocardial infarction, definition, causes, risk factors and signs and symptoms. So my dear students, that's about today's session. I will continue the next session remaining rest of the topic. Until that, stay tuned. Please like and share and subscribe. Thank you so much, my dear students.